Hi everyone, I wanted to come on today. I know I always get a lot of questions from nursing students how to prepare for the clinical day. So I wanted to share some tips. So the first thing you want to do is make sure you're going to bed early the night before. Most of our clinicals are typically 8 or 12-hour days, so they're very long. And especially as new nursing students, your body has not adjusted to work in those long hours. So you want to make sure that you're going to bed and getting at least 7 to 8 hours. Hours of sleep the night before, and that ensures that you can wake up early, get your breakfast started. I posted another video with some breakfast and snack and lunch suggestions that you can plan to take for the clinical day. I also make sure my clinical bag, I'll show you, is packed, and this is what I use for mine. But as a student, I'm the instructor, but as a student, you can make sure you have some of the same things. So we're going through a pandemic, so you want to make sure you have your essential PPE. So here I have my my mask, my surgical mask, as well as N95. So you want to make sure you have those packed. I have my shield. And I put this in a little bag, so when I'm done, I can easily clean it and pack it away. Since you're going to be taking care of patients, depending on if you're in nursing or if you're doing nurse practitioner, you may need different equipment. So some of the basics, you want your stethoscope, and then for your assessment of the head, you want a pen light, and it's best to have a pen light with where you have the millimeters to measure the pupil size, and also the light, so you can check Perla, which you've probably been learning in nursing school. If you're a nurse practitioner, you'll probably need your otoscope, your ophthalmoscope. What else? And then of course I make sure I have pens, your ID badge. Most of the clinical sites require your ID, your school ID, or maybe the hospital ID. So you want to make sure you pack those. And then I have all my notes. So any clinical notes that you're going to need for the day. Each week, I know a lot of times for our students, they have specific assignments. So you want to make sure that you print that the week before, the night before, and have it prepped and packed in your clinical bag. And of course, pens, money. I always suggest not taking a lot of personal belongings to the unit because a lot of times it's not locked up. As far as getting dressed, you want to make sure you're in your clinical designated color scrub, whatever it is for your school. And if you're a nurse practitioner school, you'll probably need your lab coats. And I recently got mine, these new ones, labeled with the embroidered labels, so I love these. And then just some of the basic things. So you want to make sure your hair is pulled back. If you're going to be taking care of patients, smaller earrings, small ring. I always either leave my ring or just wear my wedding band. You don't want anything too bulky or too much. And that's it for jewelry. Remember, you are representing your school, you're representing the nursing profession. You always want to make sure that you look professional. A lot of times a hospital that you're doing your clinicals, you can end up working there. So the nurse managers, the nurses are looking at you, they're taking note. If you ever apply to that unit, they'll remember you. So you want to make sure you stand out, but in a positive way. All right, take care. All right, bye.